Hi everyone. Sorry for that little technical difficulty. I apologize. Don't know what was happening, but I think we're good to go now, which is good. So I want to thank you all for joining us and welcome to today's webinar titled Vaping Behaviors and Perceptions Among College Students, Results from an Informal Survey. My name is Emma and I'll be your moderator for today. I am the Assistant Director for the Illinois Higher Education Center for Alcohol, Other Drug, and Violence Prevention, and I'm very excited about today's event. Before I hand over the microphone, I had a few little housekeeping things just to cover about the platform that we are using. For those of you that have maybe never used this platform before, you will see the control panel on the right of your screen. This is where you will find the question box where you can type in and submit questions. So you can pop that little question box open and type in a question if you have one. Please type your questions in there and we will address them whenever we can. So without any further ado, I would like to hand it over to today's speaker, Brianna Sinche.
All right, thank you so much, Emma, and thanks to everyone for tuning into this webinar. I'm excited to present about some of the recent research on vaping, its health effects and trends in use, as well as our efforts at Southern Illinois University, Carbondale to better understand our students' use. I've been working in alcohol and other drug issues in higher education for the past 5 years, but it wasn't until this past year that I really started looking into vaping at a deeper level. I wasn't prepared to organize vaping prevention efforts on our campus as I only knew the very basics. So this survey project served as a catalyst for me to start learning more about the research. What I learned is that in a very short time, we have learned a lot about vaping and its effects, while at the same time, we still need to perform more research to truly understand the potential effects, especially on the long term. So to start, we are going to go over some of the very basic information about vaping. I think many of us have general knowledge about vaping and how it works, but it is an emerging trend, so many of us might not have that basic knowledge of the subject. So what is vaping? Vaping is a broad term that describes the use of electronic cigarettes known as e-cigarettes, e-vaporizers, or electronic nicotine delivery systems, which are battery-operated devices that people use to inhale an aerosol, which typically contains nicotine, though not always, flavorings, and other chemicals. So there is a lot of terminology associated with vaping, so I have listed a couple of the terms that you might hear. ENDS is the general term for all of these delivery systems, and that stands for electronic nicotine delivery systems, but it's rare that you would hear a young adult using that term. More likely, they're using the following terms for their devices: e-cigarettes, vape pen, Juuls, mods, e-hookahs, or just vapes in general. There are many more, but these are likely the most common terms. To give you a visual, here's a graphic from the CDC of the most common devices. The large tank devices would most likely be considered your mods, and the medium size would be likely your pens. The most known rechargeable device would be Juul, and finally the disposable e-cigarette. Each of these categories have dozens of products within them, and they are constantly coming out with new products on the market, and many of them don't even resemble any of the ones that are shown here. So most ends contain 4 basic parts. First is a cartridge or a reservoir, which holds a liquid solution known as e-liquid or e-juice. And these juices contain varying amounts of nicotine, flavorings, or other chemicals. The second is a heating element, which is usually a coil. Third is a power source, usually a battery. And fourth is a mouthpiece that the person uses to inhale. There are literally hundreds, actually over 400 different e-cigarette brands and hundreds of kinds of ends, and they can be modified to meet the user's likes and to better deliver the effects of certain substances. For example, mods, which is short for modification, typically have more powerful heating units, a larger e-liquid capacity, and a bigger battery when compared to the basic e-pen or vape pen. Additionally, you can modify your pen to burn at certain temperatures or choose higher quality materials. But in general, all ends contain variations of these four components. So how does vaping actually work? In really simplified terms, the battery heats up the heating element, which then turns the e-liquid into an aerosol, which is then inhaled into the lungs and then exhaled. The aerosol can also be called vapor, hence the term vaping. So now that we know the very basics of vaping, the big question on everyone's minds is vaping safer than using cigarettes? The answer in short is that they may be safer, but safer doesn't mean safe. The National Institute on Drug Abuse and the CDC agree that research so far suggests that e-cigarettes can damage a person's health, but are less harmful than traditional cigarettes when people who regularly smoke switch to them as a complete replacement. So if we're considering vaping as a harm reduction method, the research so far is suggesting that it likely reduces some of the harms associated with smoking traditional cigarettes. As we know, cigarettes contain 7,000 chemicals, with 69 of them known to be toxic or cause cancer. And while vaping does involve several chemicals and toxins, it is not to the level of traditional cigarettes. But as we will discuss in just a bit, for people who've never used cigarettes in the first place, vaping is increasing risk, not decreasing it. As I mentioned before, and will likely say it again, research on this topic is somewhat limited. We don't have many longitudinal studies on the effects of vaping, so our knowledge on the topic is limited. But it is the stance of both NIDA and the CDC that vaping likely produces less harmful effects than traditional cigarettes. So what does the research that has been performed tell us about the health effects of vaping? To start, we know that if you vape e-juice with nicotine, you are exposed to all of the harms we've known about for years. First and foremost, nicotine is a very addictive drug. Many of us who are former smokers or who work in health education or tobacco cessation know that nicotine addiction is real and it makes quitting very difficult. Like most addictive substances, nicotine activates the brain's reward pathways and increases levels of dopamine, which in turn makes us want to repeat the behavior. In addition to the addiction to nicotine itself, research has suggested that nicotine addiction can, quote unquote, prime the brain's reward system. And what that does is put users at risk for addiction to other drugs in the future. Just as we know, smoking cigarettes is harmful to developing fetuses, the same can be said about vaping with nicotine. The nicotine puts both the pregnant mother and the developing fetus at risk. Finally, we know that nicotine can harm adolescent brain development. This brain development continues well into your 20s, so we aren't just talking about middle and high school students. College students are affected by this as well. It affects the part of the brain in charge of attention, learning, mood, and impulse control, and affects how synapses in the brain are formed. Anecdotally, I've heard many students who vape say, well, it's better than smoking because all it has is nicotine. But as we've known for a long time, there's no such thing as just nicotine. So how much nicotine are we talking about? Well, we know that e-juice is sold in increments from 0 milligrams to about 36 milligrams for a typical e-juice. And for reference, a typical cigarette contains approximately 12 milligrams of nicotine. So if we take a Juul pod as an example, since those are extremely popular with teens and young adults, most Juul pods contain 5% nicotine, which is 50 milligrams. And according to their website, on average, a Juul pod has 200 puffs, which is approximately the nicotine content of one pack of cigarettes. I wasn't able to find data on how quickly most users go through a Juul pod, so we can't really estimate daily nicotine intake. Another interesting point of comparison is cost. A Juul pod costs $4, which is equal to the nicotine pack of 1 cigarettes, which has an average cost of $8 to $9 in Illinois. So there is a significant price difference, which if you look at the Juul website, they're very quick to point out that cost savings as well. So what else has research shown to be potentially harmful about vaping? Well, the aerosol or vapor that is both inhaled and exhaled has a bit more than water, as many advertisers would have us believe. I particularly like this quote from a review article from the New England Journal of Medicine entitled The Health Effects of Electronic Cigarettes. And it says, the constituents of the aerosol generated by e-cigarettes and inhaled by the user are more directly relevant to health than the ingredients of the e-liquids. This quote addresses the idea that many people hold that e-juice only contains ingredients that are commonly used as food additives and are considered to be safe for oral ingestion. But this idea doesn't take into account that oral ingestion differs from inhalation and that the vaporization process results in the breakdown of chemicals. So analysis of e-cigarette liquids and aerosols have revealed the presence of constituents other than the listed ingredients. The National Institute on Drug Abuse references research that finds that e-cigarette use exposes the lungs to several chemicals, some from the e-liquids and others produced during the heating or vaporizing process. One study of an e-cigarette product found the vapor contains known carcinogens and other toxic chemicals, including toxic metal nanoparticles from the device itself. These nanoparticles, just as they sound, are very tiny and have the ability to reach into the tissues of the lungs. This study also showed that the e-liquids contain high levels of nickel and chromium. They determined this is possibly could come from the nichrome heating coils of the vaporizing device. They also found low levels of cadmium, which is also found in cigarette smoke that can cause breathing problems and disease. And as a note, this study only examined certain brands of e-juices and devices. And one of the difficulties of studying the effects of e-juice and vaping is that there are so many kinds of brands, it's impossible to analyze each one. We can't make broad generalizations, but a great resource for someone who's looking for more information on chemicals in the vapor is an article in the Journal of the American Heart Association, which has a really great chart that lists 17 chemicals detected in e-cigarette vapors, the concentration range found, and the biological systems affected. And I have that article listed in the references section of the PowerPoint. So we've discussed the effects of the vapor from e-cigs to users, but what about the second and third hand effects? Multiple studies have found that the vapor exhaled when vaping is not just harmless water vapor. These studies have determined that there were significant changes in the indoor air quality after vaping, specifically an elevation of air nicotine concentrations and smaller elevations in aldehydes and small particles known as PMs or particulate matter. Surprisingly enough, a detectable amount of nicotine was also found on the surfaces of the e-cigarette users' homes as well, suggesting a potential for third-hand exposure as well. Although we've just started to get more and more information on this topic, again, more research is needed on the exact content of the vapor and the related health consequences to the user and bystanders. So to end our discussion on the health effects of vaping, I do want to mention very quickly some other research that is unveiling additional risks. To begin, cancer. Studies are showing that e-cigarettes are likely less carcinogenic than traditional cigarettes, but they actually do deliver carcinogens that can have effects at low levels with repeated exposure. However, these levels are much lower than levels in traditional cigarettes. While many people tend to focus on the potential for cancer, it's actually the cardiovascular and lung diseases that are more important for smokers. So what does the research say about cardiovascular effects due to e-cigarette use? Well, most of the research focuses on the role of those ultrafine particles and how there are significant increases in cardiovascular risk, even with low levels of exposure to the particles. These particles can trigger inflammatory responses, are implicated in cardiovascular disease and events. Most recently, a study found an increased risk of heart attack with e-cigarette users, even after adjusting for smoking traditional cigarettes and other risk factors. Again, for more detailed information on the cardiovascular risks of e-cigarettes, I encourage you to read the Journal of American Heart Association article listed in the references. Finally, lung effects. We just discussed in the previous slide all of the different chemicals and compounds that are found in the aerosol, as well as some of the related issues. But in general, we have found that the aerosol has adverse effects on the lungs, on pulmonary function, and has been linked to symptoms of chronic bronchitis and asthma. Although we don't have good longitudinal data on the long-term effects of e-cigarette use on some of these health issues, the annual review of public health is quoted as saying, "The similarities between the effects of e-cigarettes and those of conventional cigarettes on determinants of cardiovascular and lung disease make it likely that e-cigarettes will impose similar long-term cardiovascular and pulmonary risks as those associated with conventional cigarettes. However, as we've mentioned before, the magnitude of those risks are likely smaller." Another aspect of vaping that has been a popular topic of discussion is whether vaping is an effective tobacco cessation tool. A recent CDC found that many adults are using e-cigarettes in an attempt to quit smoking. As we've mentioned previously, it's the opinion of the CDC and NIDA that vaping poses less risk to an individual when compared to smoking tobacco, but that doesn't mean that it's an effective tool to quit smoking. And that thought has been backed by the FDA, as it has not approved vaping as a cessation tool. The research on its effectiveness as a cessation tool are a bit mixed, but two randomized control studies did find that e-cigarettes with nicotine help smokers stop smoking compared to a placebo without nicotine. Other studies done in Europe found the exact opposite results, with people who used vaping as a cessation tool were less likely to quit than those using traditional cessation methods. Additionally, they found that those who used e-cigarettes were more likely to also smoke more traditional cigarettes. This brings up another research topic that is still being investigated, this idea of dual use, using both e-cigarettes and traditional cigarettes at the same time. A recent CDC study found that most adult e-cigarette users do not stop smoking traditional cigarettes and instead are continuing to use both products. Another study completed in 2014 found that 93% of adult e-cigarette users continued to smoke cigarettes. So we really don't know if e-cigarettes are less, equal, or more effective than currently FDA-approved tobacco cessation methods. And we can't say that the majority of people truly stop using traditional cigarettes when using vape as a cessation tool. Again, there's a lot more research that needs to be done before making any concrete conclusions. So now moving on to some information that we do know. The number of people vaping is increasing at rapid rates, especially among youth. The increase is so significant that the US Surgeon General actually declared it a public emergency in December 2018. This graph is from a publication out of Georgetown in 2018 that maps out youth vaping rates based on 4 different youth surveys from 2011 to 2017. The authors identified 2014 as the year that vaping really took off, and it's demonstrated in this graph, as well as supported by retail sales data. After 2014, we have a lot more surveys, including questions on vaping, so we have a lot more data to compare. Now you might be thinking, well, there's a pretty wide range of numbers for each of these years reported. For example, in 2015, we see a range from around 24% all the way down to 13%. The authors of this publication also noticed this and determined that the various ways of asking the question and the terminology used significantly contributed to the wide range of prevalence. For example, did the question ask about vaping or e-cigarettes or Juul, or did they list them all? So survey questions and their design does play a significant role in our estimates. As I mentioned, in 2014, we saw a huge jump in usage, and again from 2017 to 18, we saw another huge jump. The FDA recently published the results of the 2018 National Youth Tobacco Survey and reported an increase of 78% in high school use. This results in over 3.6 million youths using e-cigarettes in 2018. If we look just at seniors in high school from the Monitoring the Future survey, we see even higher rates of use, with 37% having used e-cigarettes within the last year. So what are the reasons behind so many young people starting to vape? Studies are indicating several reasons, but it seems to be that knowing a friend or family member who uses is a big factor. If we look at the 2016 National Youth Tobacco Survey, they looked at self-reported reasons for e-cigarette use among U.S. middle and high school student e-cigarette users. The survey showed that top reasons for use were used by family or friend or family member at 39%. Second was the availability of flavors such as mint, candy, fruit, or chocolate at 31%. And the third was the belief that they are less harmful than other forms of tobacco and cigarettes at 17%. If we look at another survey, the 2017 Minnesota Youth Tobacco Survey, they also looked at some reasons behind use, and they found that being highly exposed to vape advertising, living with someone who uses, and having a best friend who uses were the top three reasons for initiation. We also have data on the least likely reasons why a teen would initiate use, and they include they're easier to get than other tobacco products, such as cigarettes, at 5%. They cost less than other tobacco products, such as cigarettes, 3%. And famous people on TV or in the movies use them at 2%. So this data really gives public health professionals a really important insights into teen use and potentially direction on how to curb use. As family members' usage plays such a significant role in teen use, it suggests that efforts to reduce adult use could in turn reduce youth use. Additionally, flavors continue to be a draw for youth. Regulations on its use in products and their sale should be addressed. The FDA is already moving towards this, as a press release in November 2018 indicated that they want to move towards having all flavored ENDS products other than tobacco, mint and menthol flavors or non-flavored products sold in age-restricted in-person locations and if sold online under heightened practices for age verification. In March 2019, just last month, these recommendations were published in a draft guidance for industry, but many health policy advocates say it does too little to address the rapidly rising use among teens and comes too late, as the regulations likely won't take effect until 2021. Finally, to address the number 3 top reason for use, youth likely need to be educated on the potential for health consequences of vaping. Even though that we know that current cigarette smokers can likely reduce their risk by switching to vaping, individuals who never smoked cigarettes to begin with are putting themselves at increased risk by vaping. Now, many of the students who took these 2018 surveys are now at our institutions of higher education. So what does vaping look like in this population? Unfortunately, we don't have as many large national surveys to look specifically at the young adult population, but we do have the National College Health Assessment, which is through the American College Health Association. So I've listed the last 4 years of data for 30-day use of e-cigarettes from the National College Health Assessment. Previous to 2015, e-cigarette use was not included in the NCHA, and as mentioned before, the wording of the question makes a huge difference in prevalence estimates. In this particular survey, the wording only mentions e-cigarettes, which could possibly lead to lower estimates. That being said, we did see a significant bump in use from 2017 to 2018, just like in the other surveys, which possibly indicates that college students are following similar trends as high school youth. So what else do we know about vape use among college-age people? Well, we know that 40% of them have never been regular cigarette smokers. This is in huge contrast when we look at adult vapers 45 years and older, with only 1.3% of them never being cigarette smokers. But that means that 60% of college-age vapers were cigarette smokers at one point in their life. To me, that is a key data point that we need to take into account when we think about potential programming or interventions with this population. Other research that looked at college students' perceptions of harm and addictiveness of e-cigarettes has suggested that students perceive less harm and less addictiveness when compared to traditional cigarettes. Additionally, students who currently use e-cigarettes were more likely to perceive less harm and addictiveness when compared to non-users. As we'll discuss later on, these results do mirror results from our campus survey. So that's kind of the end of our information on Vaping 101 and some information on trends. If we want to pause here and if there are any questions at this point, we can stop and answer those.
Yeah, thank you so much for all of the information. At this time, we don't have any questions, but if we want to take a few seconds and see if anybody, any of the attendees, if you want to type in, if you have anything that we can address right now, otherwise we'll keep on going.
Well, if there's no other questions, I will keep on going.
Well, we just had one come in.
Oh, we just had one. Oh, great.
Yeah. And it says, do you have any information on international students and use and attitudes?
You know, I don't have any particular research that I can quote specifically on international student use. What I do know is that international students do tend to use traditional cigarettes at a greater rate, and specifically hookah. Um, and we do know that there are such things as e-hookahs as well. So my gut feeling is that those trends from traditional cigarette use might um, be applicable to vape usage, but I don't have any research to back that up. There probably is research. I just don't. I haven't read any information on that.
Awesome, thank you. And then we do have one more. And it is, are there any cessation programs out there yet for college students to decrease this usage?
I can speak for here at SIU. I do the tobacco cessation education, and we do put in our materials that we can also help students with wanting to decrease vaping. To my knowledge, there's not any protocols or recommendations for tobacco cessation educators to help address vaping specifically. At this point, we're really just transferring the knowledge that we know from traditional tobacco cessation to vaping. But I think with the increase in numbers, we're most definitely going to start seeing recommendations for cessation educators specifically for vaping.
Perfect, thank you. And that's all we have at this point.
All right, well then we will get moving on to the second part of our presentation here. And it's a discussion of a survey that we implemented at Southern Illinois University in November 2018. We wanted to have more specific information about vaping behaviors, knowledge, and perceptions of our students in order to better address use on campus. As I mentioned, the NCHA only reports e-cigarette use, so we didn't have any additional information to help inform our efforts and prevention strategies. So this survey was intended as a quality improvement study rather than a formalized survey research that wasn't meant for publication. Therefore, our methodologies aren't as rigorous and the analysis not as extensive as survey research meant for publication. That being said, we were able to create a useful tool that allowed us to better understand our students' vaping behaviors and give us a direction for potential interventions. After completing the survey, we decided that the best way to move forward at this point was to implement a messaging campaign based on the results of the survey. As you can see, we named the campaign Clearing the Clouds to play off the vape cloud imagery and language. There are 5 messages or images in the campaign, and we will go over them as we discuss the results of the survey. These messages were posted all around campus in varying formats, including TV screens, digital messages, billboard-like signs, paper flyers on bulletin boards, and in the information packets of incoming students at their new student orientations. The first survey that we implemented was a very short 3-question survey that went out to all currently registered students via D2L, which is Desire to Learn, which is SIU's online platform for classes, notices, and other important academic and university information. Additionally, we distributed paper surveys at the Student Health Center and at the Student Center. A total of 1,914 students completed the survey. We were really surprised at the number of responses, as traditionally it has been difficult to get responses to surveys. We think that one reason for the good response rate was the short length of the survey as well as the subject matter. As we discussed, vaping is a hot topic and use is increasing. So I think students were intrigued to see what the survey was about. The three questions in this first survey were, do you vape? Does vaping go against our smoke-free campus policy? And does vaping have the potential to cause negative health consequences? So here are the results. 28% of respondents indicated that they vape. We made sure to indicate all the different kinds of devices in the question, as we learned from prior research that specificity is really important when asking that question. This number is significantly higher than the estimates from SIU's fall 2017 NCHA survey of ever use, which was about 12%. But we know from the other surveys that use nationwide has drastically increased from 17 to 18. For example, the 78% increase in high school vape use from 2017 to 2018. So even if people who vape were more likely to take our survey, we can still confidently say that vaping in our student population has increased from 2017. The next question showed that the majority of students were either unsure or were wrong about the inclusion of vaping in the campus smoke-free policy, with only 46% of students correctly answering. Our campus has been smoke-free since 2015, and there was a large effort in 2015 to educate the campus, but to my knowledge, specific information about vaping was not included. And this makes sense as we learned that vaping really didn't become mainstream until 2014. So that is the first point of data that we decided to use in our messaging campaign. As you will see, all of our messages contain images associated with vaping, including the device themselves or the vapor. We decided to do this as it mimics actual vape ads and will hopefully catch the eye of students. For example, in this image, we featured a Juul, which is one of the most commonly used devices among adolescents. As we know that the students who will be entering college this coming fall are vaping at an extraordinary rate, we are working with our new student programs department to get this messaging in all of the incoming student packets, not only to educate them about the policy, but also to inform them about cessation services available at the university. As a side note, IHEC will be hosting another webinar next week on the 30th on how to create effective health messaging. And I really wish I would have seen that webinar before making our campaign, but there is always room to view it and apply what I learned to make changes to this campaign for the future. So that was our first message that came out of the survey research. The last question in the initial survey was about negative health consequences. Surprisingly, the majority of students agree that vaping has the potential to cause negative health consequences, with only 8% of the sample indicating that they disagree or strongly disagree. I'm not sure if anyone else was surprised by this, but I certainly was. From the limited research I've read on the subject, I assumed that our students would be in disagreement and report that vaping had little to no consequences. This was a really important piece of data as it suggested that our messaging campaign should stay away from education around health consequences. We didn't need to convince them of it, they already agreed. We also did some bivariate analysis on the 3-question survey to see if the data suggested potential differences between users and non-users. We found that there were more people who vape who were mistaken about the smoke-free policy when compared to non-users. 41% of vapers answered no, compared to only 23% of non-vapers. This suggests that the entire student population could benefit from this education, but we should put an extra effort in educating current vapers. When we looked at the differences between users and non-users' beliefs about health consequences, we did see that the majority of both groups did agree that vaping has the potential to cause negative health consequences, but vapers agreed to a much lesser degree. 83% of non-users versus 57% of users. So this tells us that our original conclusion from the univariate data stands, but vapers could benefit from education on this topic. Since this was such an interesting point of data, we decided to use this as our next topic for the messaging campaign. Since the majority of students who vape agreed that vaping has the potential to cause negative health consequences, we decided to use a social norming approach to messaging. Social norms campaigns aim to correct exaggerated or inflated perceptions, in this case, perceptions of the health consequences of vaping. The thought is that when an individual learns what the norm is, or they learn how the majority of people are behaving or thinking, they will be less likely to participate or believe in the extreme. While our survey collected data on actual beliefs, we didn't collect data on perceptions. So this would be a great topic to learn more about in future surveys to determine if social norming truly is the best approach for this kind of data point. So after the initial 3-question survey, students who indicated that they currently vape were given the opportunity to take an additional survey. This was 20 questions long and asked more specific information about vaping behaviors and perceptions. We offered a chance to win one of 3 $25 university bookstore gift cards as an incentive. We were also quite happy with the number of responses to the survey. 361 students completed the survey, which is about 33% of vapers on campus, according to the 2017 NCHA estimates. So I'm going to go through the results quickly as there are many interesting aspects that are worth pointing out, but please let me know if you have any questions or would like me to discuss any of the points further. So the majority of respondents indicated that they started using within the past year, with only 17% having used more than 3 years. When we broke the data down in a bivariate analysis, we found, as expected, that older students had been vaping for a longer time than younger students. Additionally, 55% of 17 to 18-year-olds started vaping less than 1 year ago. This means that our freshman students likely started vaping their senior year of high school or started once they got to college. These results suggest that for those of us in higher education, those first couple of months of the fall semester is a really important time for education and intervention for our freshman students to hopefully prevent or at least delay initiation of use. The next data point was whether or not students started vaping to quit cigarettes. As we learned, vaping as a cessation tool is very popular, but its effectiveness is still unknown. In our sample, 36% of students started vaping to quit cigarettes. When we broke down this data, we saw that students 24 and older were much more likely to have started vaping as a way to quit than those 17 to 18-year-olds, with 67% versus 25%. This suggests that cessation efforts might be better targeted towards older or non-traditional students. The next question asked what devices students specifically use to vape. Students were able to check multiple options, and the 2 most popular were vape mods or pens, followed by Juul. The original or first generation e-cigarettes are now rarely being used, and I have a feeling that we might be seeing even more use of Juul, as that is particularly popular amongst high school students. Our next question assessed the frequency of vaping. The large majority, 61%, indicated vaping more than once a day. So for most students, this isn't an infrequent behavior or an every once in a while activity. It is a daily behavior. Additionally, the majority also indicated using e-juice with 6 milligrams of nicotine, with people who started vaping to quit cigarettes being less likely to use e-juice with 0 milligrams of nicotine, which makes sense. Finally, the data shows that 17% of students are not sure of the nicotine content in their e-juice. This is a data point that we decided to use in our messaging campaign to empower students to educate themselves on the contents of chemicals that they are inhaling. But before looking at that message, I did want to mention that while this information provides us with some really important insights, I think the next step would be to ask some further questions about how many e-juice pods or cartridges are students using within a day, a week, or a month, how long they are typically vaping, is it 5 minutes, 15 minutes, 30 minutes, as well as how often they are inhaling. This information would give us more specific data to help estimate the amount of daily nicotine intake. So as I mentioned, we wanted to use that data that suggested that many students are unaware of the nicotine amount in the e-juice as another topic in our messaging campaign. We decided to use the Juul pod as the example because Juul pods contain an extremely high percentage of nicotine compared to other e-juices. One pod contains 5% nicotine, which is approximately 50 milligrams, while other juices are between 0.5% and 3%, which is 5 milligrams to 30 milligrams. As we discussed before, one Juul pod contains the same amount of nicotine as a pack of cigarettes. So the purpose of this message was to first educate students on Juul specifically, and two, to be a potential cue to action for users to educate themselves on the amount of nicotine in their e-juice. Another reason why we decided to use the Juul as a reference in this message is because Juul is exploding in popularity. Sales currently represent over 70% of the e-cigarette market share, and it is worth approximately $38 billion. This popularity has pushed other e-cigarette manufacturers to start increasing the nicotine content in their products in order to compete. And as we know, increasing the nicotine content will only increase the risk for addiction. Another interesting fact on Juul is that they use a patented formula of nicotine. Juul utilizes nicotine salts, which are more similar to the natural structure of nicotine found in tobacco leaves, whereas most other brands use a modified form called free-base nicotine. So Juul's nicotine salts make the drug more easily absorbed into the bloodstream and makes the vapor less harsh so that it is easier to inhale for extended periods. This, for obvious reasons, is one of the reasons why health professionals are so concerned about the popularity of Juul. Our next set of data looked at purchasing behaviors. Surprisingly, the majority of students reported spending $20 or less a month on vaping supplies. This was interesting to me as they also reported vaping multiple times a day, which would suggest that they would need to purchase more supplies. It is possible that they are vaping multiple times a day, but for very short periods or aren't inhaling as frequently. Again, we would need to do a follow-up survey to determine those behaviors. Another aspect of purchasing behavior that we found in our bivariate analysis was that students who started vaping to quit cigarettes tend to spend more than $20 a month on supplies when compared to those who aren't using it as a cessation tool. We also looked at where students are purchasing their vape supplies, and the majority indicated going to specifically to a vape store. Vape shops are popping up everywhere. In our little city of Carbondale, Illinois, we have 4 vape shops for a population of 25,000 people. The next set of questions asked about students' beliefs about the health effects of vaping. As we saw in the initial 3-question survey, the majority of vapers agreed that vaping has the potential to cause negative health consequences. In this follow-up survey, it was 62%. But in contrast, when we asked students whether they felt that the vapor exhaled had the potential to have harmful effects to the people around them, we saw the direct opposite. Only 21% of students disagreed to the statement, meaning that they do not think there are harmful secondhand effects of the vapor. In the bivariate analysis, we found that students who strongly disagree that there are health consequences associated with vaping are also more likely not to believe that the vapor exhaled has the potential for harm. Additionally, and interestingly, we found that students who recently started vaping were more likely to believe that vaping has the potential to cause negative health consequences compared to students who have been vaping for a longer period of time. To me, that was a little counterintuitive, as we might expect students who have used for a longer period to be more aware of the health effects, or maybe even have experienced health effects. But after reflection, one potential explanation is that older students in our survey are more likely to have started using e-cigarettes to quit traditional cigarettes and are comparing the relative health risks of cigarettes to vaping. So in comparison to traditional cigarettes, vaping doesn't cause that many issues. This idea was also reflected in some research published by the Journal of American College Health in 2017. This is something that I think would be really interesting to look into further as a way to better target health messaging around the effects of vaping. So this brings us to our next message in the Clearing the Clouds campaign. Since students were less likely to be aware of the second and third hand effects of the exhaled vapor, we decided to focus on the ultrafine particles as they affect both the user and those around them. As you can see, the message reads, that cloud is more than vapor. Ultrafine particles found in e-cigarettes are associated with increased cardiovascular risks, and ultrafine particles exhaled from vaping linger in the environment and on surfaces affecting others. Now, here are the final pieces of data that I want to share, the likes, dislikes, and reasons to quit. We found that the top 3 reasons that people like vaping is the taste, the nicotine buzz, and that they are healthier than cigarettes. It wasn't a surprise that the taste was the top reason, as we've seen previous research about the effectiveness of adding flavorings to tobacco to entice younger users. Additionally, since 36% of our survey respondents started vaping to quit cigarettes, it makes sense that a top reason would be that vaping is healthier than cigarettes. If we compare this data to the National Youth Tobacco Survey data that we discussed earlier, 2 of the 3 reasons were the same, with the only difference being our students mentioned the nicotine buzz and the youth mentioned friends and family using. As for what they don't like about vaping, the number 1 dislike was cost. This is interesting as vaping tends to be less costly than traditional cigarettes, but if you never smoked traditional cigarettes before, the cost associated with vaping can add up. The second dislike was that it was treated like smoking cigarettes. This likely is in response to expansion of policies to include vaping in smoke-free areas, as well as could be related to the user's disagreement that vaping has effects to those around them. And finally, the third dislike was health consequences, which only reinforces our data that shows that vapers are aware of and agree that there are health consequences associated with use. Finally, when we asked about what would be a reason why they would cut down or quit vaping, the top 3 reasons were cost, health effects, and more restrictive laws on where use is allowed. Which brings us to our final message from the campaign. This message utilized the top reasons why vapers would consider cutting down or quitting. We just mentioned a couple of them, but social pressure and environmental impact were also mentioned. The purpose of this message was to serve as a cue to action for the user to start thinking about quitting or cutting down. Additionally, it meant to normalize thoughts of quitting by providing examples of why other users are thinking about it. So quickly looking at the demographics of the follow-up survey of vapers, we see that our average respondent was a white, non-Hispanic male. The majority of the respondents were between 19 and 23, and many identified with Greek life and the LGBTQ community. We know that the LGBTQ community has higher rates of cigarette use, so it wasn't much of a surprise for this to transfer to vape usage. However, to my knowledge, there isn't much research about vaping among the Greek community, so this was a bit of a surprise for us. As we move forward with our outreach, we plan to find specific ways to target these populations. So to wrap up our discussion on this messaging campaign, I wanted to frame our messaging efforts into the socio-ecological model of programming. This model suggests that to create the greatest impact, interventions should be made on the individual, group, or interpersonal, as well as the campus or community level. On the campus level, we're educating the campus body of the smoke-free policy that includes vaping. As I mentioned, this information has been sent out widely across campus to all students on campus via email and to all incoming students. On the interpersonal or group level, the messages utilize a social norming approach to normalize beliefs of potential harm, as well as normalize the desire to quit or cut down. And finally, on the individual level, the messages were formulated with the health belief model in mind, specifically cues to action. The messages provide information and promote awareness of nicotine levels and first, second, and third hand exposures, and serve as a cue to action to activate potential readiness to change behavior. So where do we go from here? There are many possibilities, but I've listed the top 4 things that we could do right now. First, we can do a follow-up survey to assess any change in knowledge and perceptions. Our messages were distributed on the 3rd week of March, so they've been out there for approximately 1 month. We plan to send out a follow-up survey the 1st week of May and ask the same 3 questions we did in our initial survey to see if any impact was made. Normally, we would like to have waited a bit longer before following up, but the end of the semester is the 2nd week of May. Based on the results of this follow-up survey, we will likely modify our messages. Additionally, after watching next week's webinar on creating effective health messaging, we will also revisit our messages based on the information we learned in that webinar. Second, I have plans to provide a workshop with our medical clinic staff at the Student Health Center at SIU to educate them on vaping, health consequences, and the increasing trends. As this is an upcoming trend, many of our health professionals don't have a base knowledge to effectively have conversations with patients about vaping, so the workshop will hopefully provide them with a starting point. Additionally, we are going to be modifying our electronic medical record to include questions about vaping in the social history section, in addition to questions on tobacco, alcohol, and other drug use. Next, we will start including information on vaping in all of our alcohol and other drug-related presentations. I work out of the Health Education and Promotion Office on campus, so we can easily start incorporating this into our educational efforts. Furthermore, we will begin asking students who are mandated for substance use education from our compliance office about vaping behaviors in their intake forms. This will provide us with another set of data to monitor and track changes. And finally, we need to continue to pay attention to the research as new studies are constantly being published on the topic. What we think we know now might change in a couple of months. And with this increase in research and knowledge, policy changes and recommendations are likely to follow. As we've already seen, the FDA is putting forth regulations on the national level, but we also have the ability to affect policy change within our communities and organizations. So I encourage everyone to look at your tobacco policies at your workplace and universities to see if vaping is included, and if not, identify ways that you might be able to incorporate it into your policy or affect change at your organization. So that brings us to the end of the webinar. I wanted to take this time to say a special thanks to Kyle Miller, who is our graduate assistant who worked on this project with me from start to finish and provided really valuable insight and contributions. So thank you so much, Kyle. At this time, if there are any additional questions, I would be happy to answer.
Yeah, we do have a few questions that came in. The first one is, where did you get your visuals and images for the messages, and are they available?
Yes, we routinely utilize a resource of free images. There are databases online where you can get free images. A really easy way to do that is if you go to Google Images, and under the Tools section, you can filter by usage rights, and you can find things that are labeled for reuse with modification, and you can find things that way, as well as there's other databases online for really high quality images. And surprisingly, there was a lot of vaping images available, and we were surprised by that, and I think they really do make the messages stand out.
Awesome. We also have a question asking if you have a summarized report of the results that could possibly be available.
I have some documents that I have put together. I could most definitely make a shorter version and send that out to you, Emma, and then you could send it out to the attendees. Most definitely.
Awesome. And we have one more. Do you have any advice on adding e-cigarettes or vapes to an existing smoke-free campus policy?
That's a difficult one. I think absolutely, if you have a tobacco-free policy, it might be a little bit easier, but we don't have an all-encompassing tobacco policy at SIU. We just have a smoke-free policy. But I would suggest utilizing some of that research that discusses the second and third-hand effects of vaping as a potential way to start a conversation about why it's important. I think there is this perception that the vapor is just water vapor, and so there's really not a reason to think about the health potential or potential for negative effects to those around them. So I think that would be my first step, is really getting together resources on why we need to be thinking about secondhand vapor, and using that as a way to kind of start that conversation of including that into your smoke-free policies.
Yeah, I think that's a perfect idea. All right, at this time we don't have any further questions, so I would just like to also thank you, Brianna, for sharing your information and sharing your campaign. I loved your visuals. I thought they were great as well. And I want to thank the attendees for joining us as well. And if you could keep your keep in mind that you'll be getting an email from GoToWebinar in about an hour. It'll have an evaluation of today's webinar in it. And in that evaluation, we get information so we can plan our future events, as well as you can find a link to our website and you can go and see what we have upcoming as well. So if no one else has any other questions, we can go ahead and end it for today. Thank you so much, Brianna. I really appreciate you presenting this for us.
Thank you so much, Emma, and thank you to iHeck and for everyone tuning in.
Yeah, thank you. Everyone have a good day. Bye.